In honor of Women's History Month, Gateway Foundation wants to help raise awareness of the unique experiences of women struggling with substance use and mental health disorders.
Gateway Foundation's president of Community Services Division, Jim Scarpace, shared with G how women differ from men when it comes to need and how their team caters to their specific needs.
We really want to raise awareness of the relationship for women between substance use disorder and mental health disorders, specifically around trauma. What we know from the research is that women are 2 to 3 times more likely to experience post-traumatic stress disorder. And that's a result of a few different factors. That is exposure to sexual abuse or physical abuse at a younger age. It also can create situations where women start to self-medicate with substances as a way to deal with that pain and that grief. And so at Gateway, we really want to bring that to attention of not only women, but families so that they know treatment and help is out there.
So you were just talking about substance use disorder, and a lot of times it affects women that have suffered sexual assault or physical assault or both. And can you tell us about the correlation between trauma and SUD?
Of course. What we know and what we've seen is about 80% of women who experience substance use disorder have what we call a trauma trigger. And that trauma experience could lead to things like depression, anxiety, unmanageable grief and loss, even mood disorders. And as a result of experiencing those very difficult to manage mental health issues, it's not uncommon to turn to substances to try to self-medicate those feelings or find a way to manage them. And that's why it's so important and so important to us at Gateway Foundation to get the message out there that treatment is available. And at Gateway, we are really focused on helping women understand the relationship between substance use disorder and trauma, and most importantly, helping them develop a plan for recovery.
And in that, helping them figure out, it's figuring out the causes, right? The underlying causes as to why they turn to substance abuse, right?
Yes. I think the first step is reaching out and getting into a treatment program, because what we know about substance use disorder is it's a disease of the brain, and it can get worse over time without support. And the consequences of that can be severe, from medical conditions to hospitalizations, possibly even death, depending on the extent of the substance use disorder and the severity. So our programs are really centered around creating a safe place for women with substance use disorder and trauma to share their story without judgment and developing a plan for healing.
And can we talk a little bit about the treatments and supports that are out there right now for women undergoing this?
Absolutely. So at Gateway, we have some specialized trauma programs for women and women only. One of those is called Her Story, which creates an environment where women can feel safe, first and foremost. Can tell their story. I've had a lot of women in those programs talk about, this is the first time I've been able to talk about my trauma, or the first time I've been able to understand the relationship between trauma and substance use disorder. And those programs utilize both evidence-based practices to help them develop skills and a plan for healing, as well as access to medical professionals, doctors, nurses, therapists, to really help them develop a recovery plan that's unique to them. Everyone's trauma experience is different, and so we want to be what we call trauma responsive, meaning understanding how that trauma experience is unique for you, helping you understand that that trauma that you experience is not your fault, but also helping you understand ways to develop a plan for healing that keeps you away from using substances to manage that, and developing more healthy skills for recovery. In addition, we want to involve families in that experience so that as women leave our treatment programs, they have a plan that families can support and encourage, which helps them, have a better chance of staying in recovery. Outside of residential, we also have outpatient programs that do the same thing and really help people develop a plan to manage that relationship between trauma and substance use disorder.
What I love about Gateway Foundation, you have an entire holistic approach.
Yes.
And you're not just thinking about the short term and the immediate, but you are thinking about the long term as well.
Yeah, really our approach is centered in a biopsychosocial spiritual wellness, which is a holistic approach, understanding again that not only is every woman's trauma experience different, but their treatment plan and their recovery plan is different, and really helping them to develop skills and a recovery plan that really addresses all of those areas. But the most important thing is recognizing, hey, I can't do this alone. Treatment works, and reaching out for help.
And if someone's watching right now and thinking to themselves, I don't think I can do this alone, or maybe there's someone that's watching that knows a loved one that is struggling, how should they approach them?
That's a great question. I think the first thing to do is let them know you love them. Let them know you're worried about them. Let them know they're not alone, that this is something that can be addressed, and that sometimes it feels hopeless when you're in the midst of it, but that couldn't be further from the truth. Really, our environment at Gateway Foundation is about creating hope and healing. And people can heal from both trauma and substance use disorder, but you have to, if you're a family member, you have to be patient with that person. Let them know what's available. Maybe plant the seed if they're not ready right now, but let them know when they are ready, you're going to be there to support them.
For more information, visit gatewayfoundation.org or give them a call at 844-975-DONE for guidance on the next steps toward recovery.